Hi, everyone. Welcome to this free webinar hosted by Prevention Plus Wellness, LLC, located here in beautiful St. Augustine, Florida, beautiful and historic St. Augustine. My name is Dr. Chudley Warch, and I'm CEO and founder at Prevention Plus Wellness. And today's brief webinar is on substance use prevention that promotes healthy lifestyles. So today's objectives, there's three of them. We can see them here. Excuse me, is to list both the one and multi-session youth, young adult, and parent programs, along with our media campaigns, professional training opportunities, and licensing options offered at Prevention Plus Wellness, or PPW for short. We're going to review the benefits of PPW programs and training over other prevention strategies. And then lastly, we're going to describe how easy it is to implement PPW programs where you're at. So let's take a look at the PPW programs first. And we're going to start with the one session programs for youth, young adults, and adults. And the top 5 that I've highlighted here are the youth programs. So starting with number 1, that's the original sport, alcohol, drug prevention plus wellness program. We have versions for high school, middle school, and elementary school. And sport is an acronym. It's not just for kids in sports. It is designed to prevent substance use, alcohol, and other drugs, as well as promote healthy lifestyles, particularly those behaviors that are lacking among young people and that protect against substance use and improve mental health, including physical activity, nutrition, sleep, and stress control. So that's the sport, alcohol, drug, PPW program, evidence-based. And then we have adaptations of sport, including the sport, alcohol, cannabis program, which we have versions for high school and middle school. The vaping or our e-cigarette PPW program, we have versions for high school, middle school, and elementary school age children. Same with the marijuana PPW program. And then we also have an opioid PPW program for adolescents. Then item number 6 and 7 are our young adult programs, the original evidence-based InShape alcohol and drug PPW program for young adults. That's young adults in college, community settings. We even have the U.S. Air Force using it, and opioid and stimulant PPW for young adults. And the last 2 items, 8 and 9, are adaptations of InShape for adults, older than young adults. We've got the InShape Wellness Lifestyle Training, or WLT, for adults, and InShape Wellness Weight Loss for adults. So these are all of our one session programs that can be implemented to youth or to adults in groups or individually, usually within a 45 to 50 minute time period. So very practical, very efficient, very powerful. And now let's talk about the benefits of the sport alcohol drug PPW program, specifically and more broadly PPW programs in general. So sport was found through our published refereed scientific journal articles and research controlled trials to show that sport prevented alcohol as well as tobacco and cannabis for non-users and the substance-using youth, as well as increasing physical activity. Strong effects 3 months post-intervention, post that single session program, and some effects even a year later. The sport PPW program, like all of our PPW programs, target not just substance use, but the promotion of healthy lifestyle behaviors, including physical activity, breakfast eating, and other healthy nutritional habits, getting adequate sleep, and controlling stress through relaxation practices. These are single session, 45-minute screening and brief interventions. The screening and brief interventions, by the way, are evidence-based practices. So all of our programs are founded on an evidence-based practices format, screening and brief interventions. They're implemented with slides, and so very intuitive, very easy. You show the slides, you read the script for presenting this to a group, That could be an intact group, a classroom, a sport team, or a group you pull together, in school, out of school, Boys and Girls Clubs, YMCAs, just about any setting where there's young people. And you can also implement it one-on-one, and that is a more tailored strategy. Organizations throughout the country will use the one-on-one strategy for high-risk youth, caught using, for example, on school campus. And you can even implement it one-on-one as an SBIRT, that screening, brief intervention, referral to treatment, because we now have a validated screener integrated with our one-on-one script. All of our programs are based on the behavior image model, which theorizes that by targeting positive future images of young people, that will motivate their desire to change multiple health habits. And the content is designed to show how these healthy behaviors promote desired future images of themselves, being more physically active, healthy, successful, fit, etc., and how substance use interferes. And then the goal setting is the initiation of the behavior change, which increases self-regulation skills. Our PPW programs are available in either a physical, in other words, a hard copy, or digital manual, and they come with digital downloads of all reproducible materials, so you can purchase the materials, and you don't have to come back and buy additional materials after that purchase. We also have an online protocol and slides if you want to present your PPW lesson virtually. So you have that flexibility, implementation in groups, individually, or virtually. And here's a table of contents of the new 2025 sport PPW programs. We've got an introduction, the group script, the group lesson script that you follow. You literally follow the script, show the slides, very simple, very intuitive, as I said. You practice the script and then you're ready to go. We do have online self-paced program implementer training with 3-year certification, and that takes just an hour or two in case you want to have that training, which will really help you understand the model, the theory, the research, and steps for implementation. The third component or section of the manual, the individual script, that's where you can implement this one-on-one. You can pull kids out of a classroom. You can give this one-on-one to high-risk kids. A lot of organizations will implement PPW not just as a universal prevention intervention for all kids, but also for high-risk kids in a selective or indicated type of prevention situation. And lastly, number 4 is all of the appendices, all the reproducible materials, screening surveys, goal plans, pre-post test, evaluate outcomes, etc., all included in your program, in your download, and shown in section 4 of your manual. PPW programs use a 3-step evidence-based screening and brief intervention process. Step 1 is screening individuals to get them to reflect on their health habits, not just their substance use, but also physical activity, sleep, nutrition, and stress control, and to reflect on that and become aware of where they're at currently in those health habits. Secondly, providing that feedback to that individual youth or the groups of youth in person or virtually. And that feedback is designed to cue positive desired images of themselves. All youth, as well as adults for that matter, have these desired images of themselves. And by cueing those, the assumption is that it'll increase motivation for change, and showing how the health behaviors promote positive change, substance use interferes with that. That's the motivational component, that feedback. And that's all in the script, just by presenting the script and the slides. And then lastly, the goal plan and the calendar log is designed to initiate the behavior change process immediately. And that's for a 7-day window to track their health habits, to avoid substance use, and increase one or more of those protective health habits that can help prevent substance use and promote mental as well as physical well-being, performance, and happiness in their lives. And these health habits are definitely lacking in 75% of all of U.S. adolescents. So the goal setting, very important, and that can be extended beyond a single week to enhance your program outcomes if you want to. We also have two multi-session PPW youth programs. One is called Sport 3. This is 3 lessons: alcohol, marijuana, and e-cigarettes, back-to-back weekly lessons. They address the top 3 substances, most frequently used substances. We have high school, middle school, and elementary school programs for classroom implementation. And we also have a sport health behaviors, which is a 6-session program, very common health education type of a program where the focus is on different types of physical activity and nutrition, as well as stress control and sleep. And of course, substance use prevention is integrated within all of those 6 lessons. And we have a high school, middle school, and elementary school versions for those, for that particular program as well. That's the sport health behavior 6-session program. Now, how does PPW, how are PPW programs implemented? How do you provide these to youth or young adults or adults? Well, the most common, or a very common approach, is implementing it to an existing group or team, and you use your PowerPoint slides and you use their script protocol, the group script, and this can be presented by anybody. Particularly those who have the manual and have the online implemented training. It could be prevention staff or teachers, coaches, nurses, counselors. We have some organizations that also have their youth leaders present these PPW programs in classrooms to their same age or younger age peers. Secondly, PPW programs, as I mentioned, can be implemented to individually or one-on-one using the PowerPoint slides and the individual or one-on-one script. This is the most tailored, probably the most personalized approach, perhaps more effective because of that. And this can be done with or without the validated screener as an expert or screening, brief, and intervention referral to treatment. So that's the individual script. Lastly, you can implement your PPW program virtually. We have slides and protocols to allow you to present your lesson to youth or adults via Zoom or Microsoft Teams or other similar online platforms. Lastly, we just created a Healthy Lifestyles Workbook. This is an optional tool to motivate and enhance skills and multi-health behavior change. If you're interested in that, check it out on our website, preventionpluswellness.com, under our workbooks and stickers. We also offer parent programs. So the first line of prevention, those programs that are given directly to individuals, youth, young adults, adults. And then the second level is trying to have parents and caregivers reinforce those messages. So what we did was we took the youth programs and adapted them for use by parents and caregivers. And we did this in the same kind of a very practical format, set it up so that you can present a 1-session training lesson to parents and caregivers to provide them with the same positive image messages and goal planning at home that would reinforce your messaging and interventions with PPW in schools and community settings. So 1-session parent training program, it includes PowerPoint training slides with notes. You take the slides, you read the notes, you practice, and then you can present that to any group of parents. You could also tailor it and design it to the needs of the parents. It includes instructor directions, as well as parent take-home materials. Very important. You can make copies of these materials and give those to the parents and caregivers after the training so they can take that home and implement that with their youth. We have 4 types or versions of our 1-session PPW parent programs. The sport parent program, which addresses alcohol, drugs, as well as the vaping, e-cigarette, marijuana, and opioid. All of those are versions of the 1-session parent program. A third level of prevention, in addition to the programs designed for individuals and for parents, are the media campaigns. Media campaigns come in 4 formats: 4 versions, one for marijuana, another one for sport alcohol, another one for vaping, and then lastly opioid. And the media campaigns, as many of you already know, are very important and efficient ways to deliver substance use prevention, along with health and safety messaging, not just to youth, but parents and to the community more widely. A great way to get youth involved. We have some organizations that will allow youth leaders to take these media campaigns and evaluate them and deliver them and tailor them to their needs, because these campaigns include not just print materials, but social media, having the youth plan the social media, switch out images, decide what kind of media formats in Instagram, Facebook, TikTok, etc. They can get really involved in this from a administrative and leadership perspective, not just as a recipient. These are fully loaded, ready to use campaigns. They can save you a lot of time and a tremendous amount of time, actually, and effort and cost, because they give you a format from which to build on rather than starting from scratch. The campaign materials are provided in digital downloads. You just take them, copy them in your computer, and you're ready to go. And the content is adapted from our youth programs and our parent programs. In addition, we have other evidence-informed and evidence-based resources like from CDC and SAMHSA within our media campaigns. Professional training is something we do, and I think we do well, and is critical to our mission. And our most popular form of training is the online self-paced program implementer training. It just takes an hour or two. You can access it anytime, day or night. And it's a great way to get an understanding and make the most out of your PPW program, to understand it and how to implement it and how to evaluate it. And that program, that training is, again, very, very flexible. And that's the online self-paced training. We also have number 2, an online PPW program training of trainers. So once you are trained as an implementer, and the implementer programs, at least once, you have an option to become a trainer if you want to train others to be implementers, and that's a live 2-hour online workshop. We also have number 3, online and on-site group trainings for program implementers and trainers. That's for 4 to 6 hours. We can do it virtually, or we can do it in your location. Lastly, or next to last, is youth leadership training. Remember, you can always train your youth leaders in implementing any of our programs and or working on our media campaigns. Lastly, don't forget, go to our website, preventionpluswellness.com, and do sign up, because we will have notices of future free webinars that address latest research associated with prevention and wellness for youth and adults. We also have 1 to 3 year unlimited program licenses, the unlimited PPW program and training license, 1 to 3 years. This allows anybody to have access to your a program digitally and to copy the downloads, as well as anybody can be sent to the training portal. And so you could really increase your prevention footprint by inviting not just everyone from your organization, but your whole region. All the teachers and coaches and counselors and nurses and youth leaders can be trained with a license much more cost effectively than buying them individual manuals and individual training. We also have a number 2, a multi-program and training license. This is where you can have up to 8 of our programs, any combination, youth programs, adult program, parent programs, media campaigns, up to 8 of them. And that's in the license, as well as the training with that. That's a multi-program and training license. You can check for more information under the heading of the licenses on our website, preventionpluswellness.com. The advantages of the unlimited license, well, as I already mentioned, you can have anyone. There's an unlimited sharing of of the training portal to get trained as a program implementer, and the digital program manual and downloads to anybody, any agency, any organization, any specialists, teachers, counselors, coaches, parents, youth leaders. you name it, during the license, you could share with anyone and really enhance the reach of your prevention strategy. You just send them the link to the training portal. Anybody can be trained. And you can, and some organizations have done this, they'll team up with others in their region, and each of them will buy, a license or two or three, and the other organization will buy a license or two or three, and then they can share. So they limit their costs, and yet they increase the access to PPW programs by sharing within their region. So if you're interested in that, I'll give you contact information to talk to us about. In fact, there it is to the left. If you're interested in our price list, there it is on the left. There's a program sample request on the right. Those are links. We also have some more resources for you. You can click and view our blogs, our news, our logic model and theory underlying our programs in the behavior image model, and the sample grant proposal, sort of grant writing season right now, beginning of it. So if you want to have some content for your grants and you want to write in PPW programs into your grants and training into your grants, there's a good start. But also you can call us anytime at 904-472-5022 or email us at info@preventionpluswellness.com. We're always here ready to help. Remember, go to our website, preventionpluswellness.com, and do drop in your name so you'll be notified of upcoming free webinars. And that's it. Thank you so much for attending this. I appreciate it. And do sign up so that you will be made aware of upcoming webinars and offers and research, etc. Thank you.